thank you for joining me for this late appointment. I do appreciate you being able to come in at such a late hour, but I do appreciate it, and I just wanted to let you know that tonight you have absolutely nothing to worry about. All of your results have come back very positive, and I don't mean that in a negative way. So tonight I'm just going to be doing some routine checkups on you, like your blood pressure, looking at your eyes and testing your vision and your ears and auditory senses as well. So please just make yourself as comfortable as possible. And I'm just going to start the examination, if you don't mind, by just getting a look at your overall complexion of your skin, which really does tell you a lot about a person. You'd be surprised, but everything looks really good. So without further ado, if you don't mind, I am going to be taking your blood pressure and just listening to your heart. Just to make sure that the whole ticker is still working properly. So take a deep breath in for me, if you don't mind. And one more time for me, please. Perfect. Well, the good news is your heart is in the last place that we left it, and it sounds like it's working just fine to me, which is really good to hear. So if you don't mind, for this next part, I'm going to dim the lights a little bit. As you know, we gave you those eye drops that might mess with your vision a little bit. You might see some blurring from certain distances, but nothing to worry about, as this will fade shortly. So let's just turn down some lights here. And just staring at the light for me, please. And following the light for me, please. And looking up for me, please. Okay, perfect. And just follow the light for me, please. And look up for me, please. Very nice, actually. That's what I do like to see. quite good reaction time as far as your pupil dilation goes. And now I would just like to take a closer look at your optical nerve, if you don't mind. So nothing to be afraid of here. Just a simple tool to check out your eye. If you don't mind, just looking straight ahead for me, please. Okay, and looking up for me, please. Excellent. Okay. Very good. I'm just looking at this side. And you look up for me, please. Perfect. Alright. And both your optical nerves are looking really nice, actually, so there's no cause for concern that I can see regarding your vision, as you did have some prior worries regarding headaches and general vision loss, but what I might recommend to you in that case is just to make sure you're staying hydrated and focusing on your mental health and just ensuring that you're not causing too much stress on yourself, which could actually result in other problems. So I'm going to try a few more tests that I'm told are quite relaxing for the most part. And they have to do with your hearing. So, this is a simple tuning fork, and I'm going to use it next to your ears. And I would just like you to tell me when you can hear the sound and when it starts dissipating slowly. Okay. Perfect. You can hear this, okay? Yeah. It's starting to fade out a little bit now. Okay. Perfect. So now I'm just going to focus on putting it on either the left or right ear. And I want you to tell me when the sound starts to fade away. About now. Perfect. From the looks of everything so far, you seem to be in great shape, and that's wonderful to report, as I like to see my patients in the best health possible. So I do have one last little auditory test for you here. So let me know if you can equally hear these on both sides. And it sounds about the same on both sides. Perfect. You do seem rather relaxed by this sound, which is great, because as I said, stress can definitely lead to headaches and general unwanted feelings. So remember, it's good to take time for yourself. And to just relax. So I want you to know that everything this evening seems to have gone perfectly, which means you have a clean bill of health, and you can return home safe and sound, knowing that you have absolutely nothing to worry about. Again, I'd like to thank you for stopping by so late, and it's always good to see you. I hope to see you again soon.